Dr. Adam Perlman says small clinical trials
have shown that people who use weighted blankets do report better sleep. They report sort of less stress and anxiety, and even one small study where they reported less pain.
Weighted blankets may cause the same responses in your body that happen when you get a hug. You get a surge of feel-good hormones, such as oxytocin.
Through decrease of cortisol, which is sort of our stress hormone, and increase of serotonin and dopamine, two neurotransmitters that really affect our mood.
The blankets help you feel grounded and relaxed, which may help you sleep better.
What is it about the blankets giving this perhaps simulation of a hug? Again, that comes likely through the physiologic response in the body.
Clients at Cryo360 in Onalaska are using the cold therapy as an alternative or complementary treatment for things like headaches, depression, stress, and anxiety.
What happens is you go into the cryotherapy machine and your body temperature, your skin temperature drops, and all of your blood rushes from your extremities into your core. And it's a fight or flight process. Alrighty, Sarah, we are ready for you.
Wearing nothing but socks, slippers, and gloves to protect from frostbite. Guys, you've got to wear your underwear. Liquid nitrogen vapor comes pouring out of vents in the chamber, and for 3 minutes, you freeze.
You are at 2 minutes and 30 seconds, and the temperature is minus 136 right now.
In an effort to stay warm, your body starts producing endorphins and anti-inflammatory proteins, which are released into the blood once the treatment is over.
It's amazing. I feel awesome. Energy boost, just on top of the world.
Many people say it feels like a runner's high at the end. The effects are supposed to last about 48 hours.
There's a time and a place for regular medicine, for surgeries, for prescriptions, and they're recognizing that sometimes it's better to go the alternate route or to do both.
This is not a replacement for medicine. It's not a replacement for a good workout. It's not a replacement for other types of medical therapy.
But what it does is it just causes a spontaneous anti-inflammatory effect on the body that pushes all the blood out of the blood vessels towards the core, towards the heart, and that's where it picks up oxygen, enzymes, and nutrients, and then when it gets pumped back into the body, it has many health effects that we've talked about. You come into our office, you would obviously fill out paperwork, we would do a health history, find out what your problems are or what your goals are, and then we would put you into a cryotherapy chamber. You would put on a robe, you would wear gloves and socks to protect your extremities. You come into a room, you get into a cryotherapy tank. It's a tank from Europe. It raises you up so your head's out, so you're not claustrophobic or anything like that. It cools to minus 260 degrees, and you're in it for up to 3 minutes. And once you come out of the tank, your body warms up. You have the option to do a little bit of exercise to help speed up that heating up process, but you don't have to do that. There are a lot of things that it helps. And so I hate to dump like this big list and make it sound like it's a cure-all, end-all, but people with arthritic conditions, fibromyalgias, the MS, even asthma or allergies, we'll see improvements. We'll see improvements with depression and anxiety.
Now, you mentioned depression and anxiety. How does that work with this?
One of the things that happens is when you get out of the tank, because you just went through an experience where the body basically said, I'm in a life-threatening situation. So it has an immediate response. So there's an endorphin boost that goes along with that. So when you come out of this tank, you have a euphoric feeling for a short period of time. And then for the rest of that day, you'll feel better. You'll have a burst in energy. So over time, they're finding that depression and anxiety patients are benefiting from it.
Want to flip the switch on feeling down during the winter months? Dr. Craig Sawchuk suggests giving light therapy a try.
Light therapy is one of our effective treatments that is actually really easily tolerated. Rarely do people have side effects of it, and it's a pretty portable type of intervention that we can do.
Light therapy is thought to affect brain chemicals linked to mood and sleep, easing symptoms of seasonal affective disorder. Dr. Sawchuk recommends using a 10,000 lux light within the first hour of waking up for about 20 minutes.
That tends to be about the sweet spot of exposure to that light. You want to make sure that the light is sitting probably about an arm's length or so in front of you. You don't have to stare directly at the light, but you want to keep your eyes open, so you could be doing things like having breakfast or a cup of coffee, watching TV, working online or scrolling through things.
Continue light therapy into the spring or whenever your mood starts to naturally improve.
Light therapy. Most patients with seasonal affective disorder or underlying depression or bipolar disease that worsen in the winter will respond well to increased light exposure. You may see benefits from walking outdoors every day for 30 minutes on a sunny day or up to 2 hours on a cloudy day. However, the reality is most of us do not have time to walk 2 hours a day, and we work in offices with indoor lighting. A light box or lamp is helpful for many with SAD, and something I use myself. When looking for a light box, check for a lux rating. Look for one that is 10,000 lux. You only need to use the lamp for 30 to 60 minutes in the morning. If you use it too long, it can actually make it harder for you to fall asleep. It's important to use the light shortly after awakening and around the same time each day for the most benefit. Be careful not to position the light too close to your face or stare directly into the light, and always follow the manufacturer's instructions. I use my light box every day in the morning, and yes, I work in a windowless office. Typically, many people see improvement in their symptoms in just 1 to 4 weeks with consistent light use. There are many models and sizes of these lamps, so take the time to research and find the one that's best for you.
You can use light therapy as a natural, non-medicinal way to treat seasonal depression, which is also known as winter blues or SAD, and how rigorous research has shown that light therapy can be as effective as antidepressant medication at treating non-seasonal depression. Light sets our body's clock, which is called the circadian rhythm, and changes in light levels can affect hormones like melatonin and serotonin. So sunlight cues these special areas of our retinas. This triggers the brain to release serotonin. And serotonin is a neurotransmitter associated with happiness. Serotonin also impacts sexual functioning, sleep, memory, learning, digestion, and other functions throughout the body. Decreased sun exposure is connected to a drop in serotonin levels, and this can lead to depression with a seasonal pattern. You may be familiar with serotonin because some of the most commonly used antidepressant medications, like Prozac, these work by impacting serotonin. But you can also trigger the release of serotonin by increasing your exposure to daylight or bright lights. Another hormone, melatonin, this is a key to our body's sleep-wake cycle. Our bodies respond to darkness by producing melatonin, which signals the body to prepare for sleep. When we're exposed to sunlight in the morning, melatonin is produced sooner and it helps us sleep more easily come nighttime. Regular sunlight exposure during the day is essential for synchronized melatonin production and a healthy sleep and wake schedule. And this is really important because sleep problems are directly linked to depression. When we can improve sleep, research shows it can improve depression symptoms 87% of the time. Light impacts our body in other ways too. The sun's UV rays have been linked to vitamin D production, lower blood pressure, and research shows that people generally have lower mood and less energy on cloudy days than they do on sunny ones. And this isn't like a brain defect or something. It's a trait that's helped our ancestors survive. So historically, our ancestors almost all worked outdoors. On cold, wet, or dark days, it was more efficient for them to stay indoors and to stay warm and to conserve energy. And the bright, hot, sunny days, it was better for them to get outside and be hunting or farming or whatever it was that they needed to do. Anxiety is not just in your head, it's in your body, and specifically it's triggered in your nervous system. Today I'm going to demonstrate for you how your cells and how your body responds to the vibrations and sounds of crystal singing bowls. How we're going to demonstrate all this is by using this device here. So what you can see is a black plate, and on top is some sand. Underneath this is a speaker. So as the speaker sounds and vibrates, it will vibrate this plate and it will make the sand on top dance, and it will form patterns. So if there's a dissonant sound, it's going to look a bit messy. If there's a more harmonious sound, it's going to look like a pretty shape. And that's how your cells are responding. As your body receives sound, it's going to move and morph in the same way that the sand will. We're going to see what patterns emerge on the plate. So here we go. Because everything in the universe is vibrating. So let me just adjust my microphone here, and you will see now this amazing pasty gong. So it's a fantastically deep sounding gong. I absolutely love it. I hope you enjoy the sun gong. Let's see what it does on the plate. What I infer from that is that the sounds from this gong, have a tremendously positive effect on the body.
This is a sound bath. And no, it has nothing to do with water, but I'm bathing in sound for therapy.
A sound bath is a non-invasive therapeutic alternative to help you relieve stress, reduce pain.
With the use of glass bowls, gongs, and other symbols, sound bathing is meant to move you to a place of self-awareness and healing. The science behind it is how our bodies respond to high and low frequencies, something regular music can't accomplish.
With regular music, it has beat. And so when we're listening to music, we kind of know what the next thing's going to be. And that's the sympathetic nervous system state that's turned on. The difference between what's on the radio and what we do here in sound healing is that we're creating this androgynous sound so that we can turn off the sympathetic nervous system state and shift you into the parasympathetic nervous system state.
A lot of my patients, when I see them come into my office and we work together as a team and we're really able to make some progress, it's really exciting. And, I can see how at ease they are, how happy they are, and, how much their life has improved since they've started on this journey with the integrative and functional medicine approach.